CASAT Podcast Network.
Hello and welcome to Season 3 of CASAT Conversations. I am your host, Heather Haslam. This season, we will explore the weighty topic of health equity. Within each conversation, we will discover insights from researchers, practitioners, and experts on this complex and important topic. We hope you enjoy today's conversation. On today's episode of CASAT Conversations, we have Claudia Martinez. Claudia is a crisis intervention support specialist with Crisis Support Services of Nevada. Welcome, Claudia. We are delighted to have you here today.
Hello. Thank you for having me.
So, Claudia, as we get started, please tell us a little bit about yourself.
Well, born and raised in California. I come from a very diverse background, so that goes back to, we have my mom, African-American, Filipina, my dad, Mexicano, just a little bit of, again, my background. Been in healthcare, now in the mental health field, and I'm really excited to be here to be able to share my experiences today.
Thanks, Claudia. What does health equity mean to you?
So for me, health equity, what stands out is equity. I think we all have a right to equal health care. Okay. We all have a right to be healthy, but more important in that aspect, we all have a right to equal health care. And for me, that's huge.
And tell us a little bit more about why that's huge or what that means to you.
Well, as I mentioned, my background, so my background, as far as my cultural background, as I mentioned, I have, my dad is Mexicano, and I feel regardless of our age, race, where we're from, we have access to equal healthcare needs. I feel regardless of our immigration status, we should all have access to just simply be healthy and not have to be denied healthcare because we are in this country illegally.
And I'm curious, what has been your own personal experience with health equity?
Well, not me personally, but I guess in regards to that, I have my family, as I mentioned, some illegal. There's times when, healthcare needs to be addressed. Healthcare, family members sick. They're not able to receive the healthcare that they need because they don't qualify for health insurance because they're illegal in the country. From my background, I come, healthcare. I've been in healthcare for over 20 years. And one of my roles at one point was working as a patient advocate. And I had the opportunity of working with individuals that are in the country illegally. They don't qualify for any type of assistance because they're illegal. Sure, there may be some government-funded programs that they may qualify for if it's a life or death situation. In their eyes, it's a life or death situation. But in the eyes of others, applying for this assistance, at times they don't qualify for it because they're not experiencing that loss of limb. So it leads them back to they're not eligible. Or if they're eligible, it's very limited. It may cover only the hospital, stay. It doesn't cover the ongoing treatment that they need. It doesn't cover, again, the medications that they need. And they're still having to cover for doctor's visits, x-ray, radiology, things of that nature. And I don't know about you, Heather, but that can be pretty costly. Mm-hmm. Nobody has that kind of money. I certainly don't. So that's kind of been my experience with that.
Well, and it sounds also like, they can gain access if it's a life or death situation. But when we talk about health and promotion of health, we know that access to care is one critical component of long-term health outcomes. So even just not being able to go for an annual visit then makes it more difficult for long-term health.
Yes, exactly. For that preventative care, I mean, they just don't have that access. So when one doesn't have access to that preventative care, it ends up turning into something bigger than what it should. For example, you can't, if one has diabetes, they can't go to the doctor. They can't afford that $150 per visit. They can't go in there. They can't afford for those. They can't afford those annual exams, those labs. It's very expensive, and it's very unfortunate. So they end up in the hospital, uncontrolled diabetes. And again, they end up, with this bill that they can't afford. So it's just a very unfortunate situation. And for me, it shouldn't be that way. I feel we should all equally have access to be healthy.
Mm-hmm. It also sounds to me like there's fear in accessing the healthcare system for fear of being deported for people who are in the United States as
Yes.
immigrants.
Yes, exactly. That is part of the reason why a lot of the times, from my experience, they're afraid to seek medical attention, and they're put in a situation where they basically need to choose to pay, their rent, their bills, or pay for their health. And it shouldn't be that way. We all play a very important role in our country in one way or another. And we all deserve to have equal access to be healthy.
Thank you. As we talk about different scenarios that impact health, some of those elements we know are racial and intergenerational trauma. And so let's start with racism. How has racism impacted you?
So before we get into that, I just, want to let you know that this is something very, hard for me to talk about. And so just to let you know, it's more of a warning. So here we go. So we all know racism is out there and very real. And unfortunately, I am also a survivor of this. So my personal experiences have broken me. And it's very unfortunate because I knew it was there, but I never really realized until it happened to me. And just to try to be silenced and never speak on it. Well, I'm speaking on it now, and I'm very proud to speak on it. My experiences have ranged anywhere from simply walking into a store, automatically assuming that I'm, going out of their way to let me know up front, hey, we don't accept EBT cards here. From that to in a workplace. And just the comments, the look of disgust as I walk by. And more importantly, the very hurtful comments. And then when it's brought to the attention of HR, supervisor, it's more of a, oh, you got to learn to just get over it. Get over it. And making me believe that it's something my fault, almost to the point, no, not almost, to the point to where I'm like ashamed of who I am. Ashamed for my skin color. And I remember at one point thinking, all right, well, maybe if I lighten my makeup, maybe I won't look as dark as I do. Maybe by then I'll be accepted. And I mean, it's very unfortunate to feel that way, to feel to the point where I'm actually looking at my skin, just trying to figure out a way. I mean, I remember at times, just the whole pulling at my skin because I was ashamed of my skin color. I mean, I wanted to fit in so bad. I wanted to be accepted. And, it's something we all still struggle with, and I've come to the point now where there's nothing wrong with me. There's nothing wrong with the way I look. And I'm no longer going to keep quiet about this. There's nothing wrong. I'm very proud of who I am, my background. But just for somebody to be able to judge somebody or feel they have the right to judge somebody and to treat them the way they treat them, it's just wrong. It's wrong. Mm-hmm. But yeah, that's just some of my experiences. And this is something that I've experienced my entire life. I've never realized what was happening. I never realized it until recently. I have my grandchildren, my children, my family. And I'm keeping quiet because I'm afraid to speak up. I'm afraid of how damaging this can be to me. But I have to do it. I'm doing it. And that's where I am now.
And I just want to thank you for showing up and for sharing your story, your experience, and raising awareness about the impact of racism on you personally. I have a question about, you talked about, in the workplace, you've experienced comments, and in the context of raising awareness about comments that are hurtful, would you be able to or be willing to share maybe a couple of those comments that kind of stick out in your mind that have stuck with you?
Well, one comment was, Mexicans are lazy. Now, for one, we all know that's not true. No, that was one comment. I think that is the comment that broke me right there. Mm-hmm. That was the comment. And again, when I brought it to the attention of my employer, it was like, you have to learn to get over it. And that right there, I just, that sticks with me. And in my mind, not in my mind. So from there, I decided, you know what, this is not okay. So I decided, you know what, I'm going to file a complaint, But I'm going to back up here because after I approached my employer, I quit on the spot. I was like, no, this is not okay. But prior to that, when that comment was made, I had filed a complaint. And I never followed through with it because I was the only woman of color. Nobody was going to believe me. There was no way of proving it. And I was afraid. Again, who's going to believe the brown girl, the only brown girl in the office? Nobody's going to believe me. So that was the comment that was made. And I just also want to share something else. Heather, there was, as I stated, I started the complaint process and didn't follow through. And I have recently, they were mailing, I received, mail. And just recently I decided, you know what, it's time to go in that drawer and pull that paperwork out because I had it tucked away. I was so afraid to open that drawer. I mean, I never opened that drawer up until about a week ago. And I did it. I opened that drawer and I looked at the paperwork and I was able to sit with it for a while. But yeah, that was a comment that was made, the feedback I received, and what broke me.
I just want to pause for a moment and honor the heaviness of what you shared. I mean, the fact that you felt like you had to quit on the spot, really just for your own survival, to protect yourself. And the shame and the fear, right, that you've experienced.
Of my kids, all I kept thinking was, sorry, when I talk about this, I shiver. So I'm literally shivering right now. But back to this, my main concern was my kids. What's going to happen if I follow through with this? So I was so afraid. My kids, my husband. And it's not fair that I have to live in fear for something that is no fault of my own. So yeah, but I mean, I am very proud of myself for pulling that paperwork out again. And it's dusted off and it's sitting there on top in that drawer. And I make sure I open that drawer at least every other day. And that is for me. That's for me.
Mm-hmm. You mentioned your kids. And I know from speaking with you before that your kids are always on your heart, living in a predominantly white community, that there's things that concern you about your kids because of the color of your skin. Can you share what kind of weighs on you or what thoughts go through your mind in the form of protecting your kids?
Yes, when they're out hanging out with all their friends, he's like most of the time, my oldest son is the only boy of color. And he'll mention to me, yeah, we went and walked our friend home, female. Me and all my friends, we'll say maybe about 8 or 9 other males, white males. And again, my boy's the only one of color. It scares me because if something were to happen to the only white female there, my son is going to have that target on his back. They are going to believe. I mean, who are they going to believe? They're not going to believe my son over the other white males. My son is going to have that target on his back and be blamed for it. Nobody's going to believe him. And there's no ifs, ands, or buts. That is what would happen. Nobody can convince me otherwise. And it's so scary. It is the scariest feeling ever. But that's my concern, even now. He's older, but I have to remind him, be careful when you're out. Please understand what I'm saying. Be smart about what you're doing. I can't tell you what to do. I understand you're an adult, but just hear me out. Racism is real. Please be mindful of what you're doing, who you're hanging out with, the types of activities you engage in.
And as we really talk about the impact of racism on health, I'm curious what you feel in your own body as the impact of carrying that constant level of worry and fear. What is the impact on your own personal health?
Anxiety in ways I can't even begin to explain. I just really don't. I can't explain the feeling, but it's always the constant fear that my son or myself or any of us can end up dead or seriously injured, hurt. Even my first night when we moved into our new home, our neighborhood, we didn't know anybody here. I was so afraid we weren't going to fit in. I was afraid. And, over time, we got to know the neighbors and we're fine. Everybody's fine. Everybody gets along. We're friends with the neighbors. But at the beginning, that was my only concern was, are we going to fit in? Are we going to fit in that neighborhood? Don't play that Spanish music out loud. Don't talk Spanish outside. Only talk English or talk low. So, fear.
Mm-hmm. I'm also aware of the impact of intergenerational trauma. So your family has experienced this for generations as well as other traumas. How has intergenerational trauma impacted you?
My mom definitely has experienced some form of discrimination. My dad is Mexicano, but he's more fair-skinned, very fair-skinned. So my mom, as I mentioned, she's African-American and Filipina. She had a hard time fitting in. Like, she wasn't Black enough to hang around with the African-American crowd, so she was always, I remember her telling me stories of being called an Oreo. I remember that. Those are things that stick with me. I remember her telling me at work, she answers the phone and they come in and they're just surprised to see a woman of color in the office. So, again, these are things that have stuck with me. I remember her going into stores and not being waited on. The store's empty. And then have somebody else come in, a white lady come in, and they attend to her almost immediately. So those are just a few of the things that I remember that stand out.
And I know in the work that you do, you're working with people who experience trauma. And I'm curious how hearing their stories sometimes impacts you as well. Or if they do, I should say.
It's more of a eye-opener for me. It can be triggering to me when I hear these stories. But all that makes me want to do is to get up and fight, to be able to give back to them, to be able to provide them with the resources that they need so they can stand up, fight for themselves. But it's very hard at times. And that's my goal. That's the road that I'm on, the path that I'm on right now. I want to be able to provide the help that they need, that I needed, to provide them with the guidance, the resources that they need, and to provide them with the strength that they need so they can stand up and speak like I am today.
And what are some of the things or resources, help, supports that are required? Like, what are some of the things that are out there that are supportive, and what are needs that you see that aren't being met?
Yeah. It's very hard as far as resources right now. I just each person is unique in their own way. There's at times when I've referred people to the NAACP. So that's a big one right there. I notice that I see it more in certain states. And it's very hard because a lot of the times I get, nobody's going to believe me. Nobody's going to believe me. Nobody is helping me. And I won't call out certain states, but there is one state, and I knew she was right. But I just would remind people in general, these are the resources. It's a long fight. Don't give up.
How do you think that we can heal racial trauma?
Gosh, speaking on it. And that's what's hard is you speak on it and people want to silence us. So it's a very bumpy road. It really is. And it comes with a lot of hurt, but it takes so much out of you. Speak on it, stand up for yourself. But the most important part for me is just speaking on it. Don't stay silent anymore. Don't give them what they want. That's what they want. They want us to stay quiet. They want us to stay in the corner, scared. No, not no more.
And so how do you feel today using your voice to share your experience in this moment?
So, yeah, well, at this exact moment, I've officially stopped shivering. And I feel a small amount of hope. I honestly don't know what's going to happen from here. I don't know.
Mm-hmm. And we can't know. what will happen from here.
Yeah, it's racism, discrimination is real. It's out there. And it just gets worse every single day. I mean, there's not one day that I can open up my social media and some sort of discrimination, racism out there is happening. There's every single day, multiple times throughout the day. It's to a point where I can't keep up with it. You know, at one point I would just close it out and sweep it under the rug because I couldn't deal with it. I just couldn't. I was still I was still in denial of what was really happening.
Mm-hmm.
But I am proud of the progress that we're making. There is some progress. People are standing up for themselves. And that brings me joy. It really does.
Well, and my hope is that having this conversation on this platform helps to raise awareness of the impacts of racism and what people may be doing that they don't even know that they're doing. But I wholeheartedly believe we need to be having open and honest conversations about experience and learn how to listen from an open heart to one another. And it's without hearing someone's experience, noticing how it lands, what feelings it brings up, what judgments it brings up. And that all requires quite a bit of self-awareness. But it's that deep learning how to practice deep listening. It is my hope that that is what helps us to heal, because I believe people using their voices, right, it helps generally to help maybe alleviate some of the weight of what we've been carrying with us, as well as feel that hope.
Yeah. I see that we're making progress. But I mean, it's just getting worse and it keeps happening. Like, enough's enough already. You know, the constant racial profiling. I mean, it's just wrong.
Mm-hmm. And it's my hope that understanding some of these racial biases, the more we can become aware of them, the more that we can change them, because they are deep rooted within our culture.
Yes.
And it's without awareness, we can't change them.
Right.
So I shared with you my hope. What is your hope?
Well, you know, I would like to see more people speaking about their experiences and don't be silenced. Don't let people silence you. There's no reason why we shouldn't be able to speak on what's happening. I mean, I would have loved to follow through with my formal complaint. But again, that fear of nobody's going to believe me. Everything was verbal. I should not have had to have walked out. I shouldn't have to have quit. I just think that employers should be more supportive and just to listen to what was said and why it hurts and why it's wrong. Not only that, it's illegal. Just to be heard. We want to be heard. We're hurting.
Mm-hmm.
Now, this was, like I said, it was a while back. I am blessed to have that support from my current employer, my previous employer. I mean, the support they provide is amazing. I wouldn't have it any other way. This is my light at the end of the tunnel where I'm at now. And I'm very happy. I know I'd never have to worry about anything like that from my current employer. So,
and what exactly does that support look like that you feel so deeply?
Well, for one, I know my employer has an open door policy. They are very culturally aware, very supportive in any way possible. When I asked for permission, I don't want to say for permission, but when I let my employer know about this podcast, they were very supportive. They were like, go for it, please. Go for it. We support you. So that meant a lot to me.
Mm-hmm.
It really did.
So it sounds like, one, you have a sense of belonging to the organization you work for.
Finally. I had a hard time finding that, just finding the right fit for me, where I can actually call home,
and
family.
It sounds like you feel accepted for who you are and all of who you are.
Yeah. You're not trying to change me.
Mm-hmm. You just get to show up fully as Claudia.
Yes.
So as we get ready to close here, what would you like our listeners to know as we close today?
To just listen to us. Please. That's all. Listen. We're hurting. We are hurting. We don't want to hurt anybody. We don't want anybody to feel the way we feel, to endure the pain that we have felt. Just please listen to us. That's all. I just want to be heard. I just want to be listened. Just listen.
Thank you, Claudia.
Thank you, Heather.
It is a true joy and privilege to hear your story. And I just really want to thank you for showing up and sharing it with us.
And I just want to thank you for providing me with this opportunity and this safe space to be able to say what I have to say, share my unfortunate experiences. It really means a lot.
Thank you. It means a lot, and it touches my heart to be here with you today. And I just have this deep hope again that this platform serves as a way for you to be heard and your experiences to be heard, and to raise awareness about the impact of racism, especially on health, and what, all of those worries and fears carry. And there is a toll that it takes throughout the lifespan. And I just hope that we can all learn to listen to one another and hear the pain and the hurt, and that we can heal. Our country needs to heal.
Yeah, I agree.
Well, thank you again.
Thank you. It was a pleasure.
Thank you for listening to CASAT Conversations, your resource for exploring behavioral health topics. We hope you found today's conversation timely and meaningful. Please share this podcast with your friends and colleagues. If you want to learn more, visit us at our blog at CASATOnDemand.org.
CASAT Podcast Network. This podcast has been brought to you by the CASAT Podcast Network, located within the Center for the Application of Substance Abuse Technologies at the University of Nevada, Reno. For more podcast information and resources, visit CASAT.org.